Hi there, I'm Jen from Repose, and I'm here just to make a little video today about hyperkyphosis and pelvis-rib alignment. So I've done a couple blogs on this now, and I just want to make a quick little video. Most of us have a bit of extra kyphosis in our upper spine. Many of us do. Kyphosis is the natural shape of the thoracic spine, which curves in this direction. And hyperkyphosis is when you have a little bit of extra curvature in that direction. Nobody wants to walk around like this. So one of the things that people do to walk upright if they've got a lot of kyphosis is take the rib cage and take it forward to bring us back up. So now the lower ribs are out in front of the pelvis and might actually be sticking out. That's totally fine. We don't want to walk around like this. But however, when we do that, we are not unfurling the kyphosis. We are not, if this is our curvature, we're not lengthening the curvature back out. We're just hinging, usually around T12 or T12L1. We're just kind of hinging and moving right from the ribs. We're shifting the ribs forward and just kind of hiding the kyphosis of our spine. When we're doing shoulder exercises or core exercises, it's really imperative that we mind the position of our ribs. So even if we're walking around upright and not necessarily kyphotic, we want to be careful of what's happening with our ribs when we're actually doing shoulder or exercises for the core. And I've done this in a blog, and I'm just doing a little video of it that you can check this at home and you can see how this works for you. I'm going to back up a little bit and just tilt the camera so that you can see, hopefully you can see my feet. Let's see, I'm going to tilt it a little bit more so I don't get too far away from you. So you're going to stand up against the wall. The camera's at a bit of an angle because I can't put it right up against the wall, but your heels are going to be a few inches from the wall, and when you look down, you want from the mid-hip to the ankle to be vertical, so that you have space for your bum on the wall. If you were to take your heels all the way, then your bum's going to push your legs forward on an angle. We don't want that. We want vertical legs. So your heels are a few inches from the wall, your feet are pointing straight ahead, and so that your bum can graze the wall, but you're not smushing the bum into the wall. And then you're just going to notice, taking the arms overhead, what happens. It might be difficult to see in the camera, but for me, my bum's on the wall, and then nothing here is on the wall until I get to my scapula, my shoulder blades. However, the curve of the low back, which curves away from the wall, is just really supposed to be right here. It's not supposed to go all the way up to my shoulder blades. So now I'm going to take my arms down. I'm going to let my head and shoulders curl forward, so you can practice this. Don't worry about having to stand up straight. That's not what this is about. What we're going to do is curl the head and shoulders forward until the lower ribs at the back come back onto the wall. So now you've got a curve where your low back is, but up here where the ribs are is on the wall, all the way down to the lower ribs. Once you've done that, you can place a hand on the low ribs, a hand on the sternum. This upper chest area should stay straight up and down. If your hand is out on an angle like that, it means you've popped the ribs off the wall. And you can just gently, we're not going to take the head back like this, which is neck hyperextension. You're going to try to unroll the shoulders and just make a double chin, like you're ramping the head towards the wall. Now stay here. This is now the current state of your kyphosis. So you're going to keep this on the wall now and take the arms up. You'll find that the arms no longer will go all the way to the wall. If they do, watch carefully my ribs. If I take my ribs forward, my arms can come back to the wall, but now my ribs are forward, so that was not a shoulder movement, that was a rib movement. So you want to keep the ribs back on the wall and just notice what happens with the arms. You probably will not get them back to the wall while keeping your ribs there. Now you're accessing your shoulders. This is really important. Anytime you're doing any work where you're trying to mobilize or stretch or strengthen your shoulders, you want to make sure that it's pure shoulder movement and not rib movement. So there's a lot of exercises I teach where we work our shoulders, but we have to mind our ribs. The next one I want you to check, I'm just going to use a bolster. This is maybe something about I don't know what this is, maybe 4 pounds, 5 pounds. It's not heavy, but it's a little bit of a load. So you're going to line back up again. Don't worry about the rib position. I just want you to see what happens when you lift it up and overhead, so the ribs might leave the wall. Notice this time, not so much your shoulders, but notice your core and what's happening. For me, I'm not feeling a whole lot happening with my core. So now I'm just going to hold the bolster. I'm going to exhale, roll my head and shoulders forward again, get my lower ribs on the wall, feel the back lower ribs on the wall back there. Unroll the shoulders without letting the ribs leave the wall. You can head ramp the head. Now keep all of that, and now start to lift this out in front of you. You may start to feel just a little bit of engagement through your abdominals, through your core muscles. And this is good. If you're not feeling it, make sure that you do truly have your ribs on the wall. The reason we want to mind the rib pelvis position for core work is that the linea alba, which connects from the sternum down to the pubic bone, it's the best alignment for the linea alba to actually provide, it's a band of connective tissue that your abdominal muscles attach to. And when the ribs are directly back, the lower ribs back so that your ribs are aligned with your pelvis, that linea alba is able to provide the tension that the abdominal muscles need. When you take your ribs forward of your pelvis, it kind of messes with that, and your abdominal muscles aren't able to work very well. So whenever you're doing shoulder work or core work, you want to mind the position of your ribs. When you're going out through the day, don't feel like you have to drop your ribs and look like this all the time. You can start to be aware of it and start to work on extending the upper back. That's for a different video. But for now, just notice the connection between rib alignment and what's happening in the shoulders, and rib alignment and what's happening in the core. And that's it.